hydration, a little bit of movement. We're back to our whole person care webinar series. I, again, am Dr. Holly Lucio. I'm a licensed naturopathic doctor, senior medical advisor here at Fullscript. And it is also wonderful to have you here for our second session in our series on personalizing sports performance for your patients that are fitness oriented, just wanting to keep their skin in the game, you name it. If you missed the first session, we explored using the 3x4 genetic test and blueprint report to personalize the care of your athletic patients. And again, those who just are really wanting to move and stay fit and metabolically healthy. So don't worry, you can catch that recording later at fullscript.com/webinars. So in this session, we're going to be discussing common supplement quality issues that athletic patients encounter, as well as the benefits of the NSF Certified for Sports Certification. Okay, next slide. So leading today's session is Dr. Greer. Super happy to have her here. She is a licensed naturopathic doctor herself, director of medical education at Thorne, and she has over 20 years of experience in medicine, in education, administration, and she's dedicated to educating both healthcare practitioners and consumers on dietary supplement use and overall health. And so before joining Thorne, she ran a private practice in Los Angeles, specializing in functional GI health, women and children's health, hormone optimization, and IV nutrient therapy. She also has a background in higher education and college athletics administration, contributing to research on student athlete health and in elite training sessions. And Dr. Greer holds a doctorate in naturopathic medicine from Sonora University of Health Sciences. I went there too, but it was called the Southwest College of Naturopathic Medicine at the time. And she has a master's of education from the University of Arkansas. And she also maintains active license in California and Oregon. So we are super proud and happy to have her here. Remember those housekeeping tips. We're going to address as many questions as possible afterwards. And if we don't get answered, we're going to make sure that we get them answered. It's being recorded, so it will be sent to you. Also, 5-minute break before our last session. And here we go. Let's get started. Dr. Greer.
Thank you. Well, great. Thanks, Dr. Holly. I am so excited to be here today and chat with you on this topic. I think quality is such an important topic when it comes to dietary supplements and dietary ingredients, whether that's for athletes or non-athletes. And so having a good background knowledge about quality, I think, is important for everyone. I just, quick disclaimer that this is, of course, for healthcare provider education only and not providing medical or professional advice. And let's dive in. So some quick learning objectives. What we're going to talk about today is understanding supplement quality, why it's important, what some of those certifications mean. So for NSF in particular, there's general, content certified, and certified for sport. We'll also talk about some risks that can be associated with quality, especially for athletes, and then a quick review of some common dietary ingredients that athletes frequently use. All right, I want to start here with this myth or fact. Dietary supplements are regulated in the United States. And so take a minute to sort of gut check how you feel about that. And the reason why I want to start with that is I see this statement made a lot from practitioners and other people, even in the dietary supplements industry. And the fact of the matter is that dietary supplements are regulated in the US. So when you see someone who says, oh, supplements aren't regulated, I think they just don't understand. Most of the time, what they mean or what they think they mean is that dietary supplements are not regulated the same way that pharmaceuticals are. And that's true. There are some differences. There are quite a lot of similarities on the front end, but there are some differences ultimately. But at the end of the day, dietary supplements are regulated in the US, and they are regulated through the Dietary Supplement Health and Education Act of 1994, which is also known as DSHEA. And two of the main points of DSHEA are that those who manufacture, package, or hold dietary supplements have to have good manufacturing practices that they follow that are well lined out and that are regularly monitored by the FDA. And for any claim that you make about a product, so whether it's a structure function claim or a benefit claim related to a nutrient deficiency, that has to have sufficient substantiation. So that means you can't just say anything about a product. There does have to be some research behind what you say, and it needs to be truthful and not misleading. Let's dive a little bit deeper into dietary supplement quality now, starting with some of these good manufacturing practices points. And so this is what the FDA requires for dietary supplement manufacturers. And you have to establish these GMPs, you have to keep them on file, you have to regularly self-audit them, and then also be audited at various intervals by the FDA. What's really important here is that you have to have product specifications for all of your products related to identity, purity, quality, strength, and composition of the finished batch. And those also have to be tested. And then beyond that, there are other requirements for manufacturers. You have to keep master manufacturing records on files. You have to have standard operating procedures that your employees are trained in and that are kept on file. There have to be specifications for those raw ingredients that are coming in, for all of the components, the labels, the finished products. All of your personnel, especially in the manufacturing related departments, need to be qualified and trained to do the jobs that they're hired to do, and that needs to be documented as well. And then there also has to be a system for investigating and following up on any sort of product complaints, whether that's for the product itself or potential side effects of a product. Now, the FDA requirements are one thing. You can also have third-party certification as well. And so a common question is, well, if supplements are regulated and the FDA does that, then why would you also want third-party certification? And so I think third-party certification is really nice because it's showing that the company has a commitment to a higher standard, that quality is not just a fancy term, that it's something they are really committed to, showing that they are not only in compliance with those good manufacturing practices, but also holding a higher standard for themselves and their products. This gives peace of mind for athletes, of course, but it's also important for healthcare provider and patient client trust when you're recommending a product that you know is certified and that you're able to say that with confidence to your patients and your clients. Within that, in the US, there are kind of four major supplement seals or third-party certifications that are commonly referenced: Consumer Lab, NSF International, which we're going to focus on today, the US Pharmacopoeia or USP, and UL. There's some slight differences between these, and you can see, in this table, I won't go into super detail, but I wanted to share this with you so you could see some of the differences between the four, whether it is the product is being provided by the manufacturer to be tested, if the third-party audit is being done by something that they bought in stores, how often it's done. So for the most part, these are all going to be done at least once per year with the original product, and then at least once per year with spot checking and retesting. The cost is different and it varies across different certification organizations. And then each one has their own sort of category of, we won't certify somebody and test products that fit into these other categories. So there's some guidelines around which one someone might choose, why they might choose that. But let's look at NSF International a little bit deeper, since that's the focus today. And I think it's one of the most common and most recognized ones across the world. With NSF certifications, we have NSF General, NSF Content Certified, and then NSF Certified for Sport. So the regular sort of general NSF certification that most people think of, this is certifying the good manufacturing practices, and it's done regularly. So there's an annual audit and certification where NSF comes to the facility. They're going to look at all of those things. So those master manufacturing records and standard operating procedures, they're going to check those out. Do you have those on file? Are you following them? What's happening in your facility to make sure that your employees are safe? What's happening with your product being made to make sure that the product is what it's supposed to be and that it is clean and safe as well? And so that certification is renewed annually. It's not just dietary supplements. NSF covers all sorts of products, and you'll see that label on lots of products when you really start digging and noticing it out there. Then there's a next level, which is NSF Content Certified. So this level of certification is by product. So this is kind of on top of that general certification level. It tests the finished product to ensure that the label claims and contents are met and that there's no unsafe contaminants in the product. And that is certified annually on each formula that carries that seal. So it is possible to have that on some products, but not others. Or it could be, you could pay for that certification for every product that a company makes. And then kind of the highest level is NSF Certified for Sport. And the NSF Certified for Sport process tests every single batch that's made of a product. So it's not just once a year, it's not just one product, it's every single product that carries that label, every single lot is tested. And it's tested to be free of banned substances, it's tested to be free of contaminants. We'll dive in a little bit deeper on that here in the next couple of slides. Why this is important is for certain agencies or overseeing bodies in sport, NSF Certified for Sport is the only program that they recognize. And there's the big four listed here for that. Major League Baseball and National Hockey League are two of those that they only recognize NSF Certified for Sport. Other professional leagues recognize some other third-party certifications as well, but they don't exclude others, but they do recommend NSF Certified for Sport. So it gives peace of mind across different athletic groups and organizations that the products are high quality and that they're not going to be a threat to the athlete who's using them. And why that matters is for an athlete, especially an elite level athlete, whose livelihood is their body, it's really important not to put that at risk. The NSF Certified for Sport logo on a product mean that every single batch that carries that logo has been tested for around 300 or more different banned substances to show that it's completely free of those. They've also been tested to show that they are free of unsafe levels of heavy metals, pesticides, and other contaminants, which is important because those are the sorts of things that can really affect mitochondrial function, cellular energy production, and muscle repair and recovery. And again, if your body is your livelihood, right, it's important to know that what you're putting in your body is going to help it and not hurt it. And then each label is reviewed for accuracy as well. And then NSF Certified for Sport, of course, ensures safer product use for athletes, but it's not just for athletes. When you see that logo on a product, you know that that's a safer product for anyone, for your patients and your clients as well. All right, so I wanted to get into some of the common dietary ingredients that athletes choose and products that come up quite frequently. The first one is creatine. I think it's certainly having a moment in popularity right now, and I think that's going to continue for a long time. Creatine is, of course, an amino acid that's found mostly in muscle tissue and in the brain. It is naturally produced in the body, but especially for athletes, their needs for creatine are higher. So much like they have a higher need for calories, they're going to have a higher or increased need for creatine as well. It's used every day by elite level athletes and everyday athletes to support strength, endurance, and speed events. But there's a lot of growing interest in creatine in other categories as well, including healthy aging, cognitive function, and even women's health. So I have a couple of studies that I found. These are, I believe both of these are recent in 2024. This is a small study with 15 participants ages 20 to 28. It was a double-blind randomized crossover trial. They were exposed to sleep deprivation on 2 separate occasions, 5 days apart. On one occasion, they received creatine. On the other occasion, they did not, and they were tested for cognitive performance. And what this study showed was that compared to placebo, that one-time creatine supplementation did improve cognitive performance for those who were sleep deprived. And the improvements lasted for up to 9 hours. So a small study, but some interesting results and something to think about as we're looking at creatine moving forward and thinking about the sorts of studies that it might be used in. And then in this study, this one was 27 females that were aged 18 to 24 with natural menstrual cycles. They received either 5 grams of creatine or placebo daily for 6 weeks. Their sleep quantity and ovulation were tested daily, while some other measures like sleep quality and body composition were measured at the beginning and the end of the study. And they were asked to complete resistance training on 2 non-consecutive days per week. At the end of the study, when compared to placebo, creatine supplementation led to improved sleep duration on resistance training days. Now, there weren't differences on perceived sleep quality or changes in muscle strength between the 2 groups, and part of that may be because it was such a small study in a younger age group of people. But it is interesting to note the effect on sleep on those resistance training days and how this might be something else to look at creatine for in the future. Next is beta-alanine. So beta-alanine is one of the two amino acids that are used by the body to make carnosine. Beta-alanine as an ingredient tends to be more efficient than carnosine when taken orally, and it's most commonly used to support the buffering of pH in muscle tissues, so that can lead to less lactic acid buildup and discomfort after workouts, and can help to improve recovery, work capacity, and performance. Carnosine levels actually decline naturally with age. So as we start to lose muscle mass, we start to lose our carnosine levels. That starts around age 50. So there's some interesting thought around beta-alanine as a potential support for healthy aging as well. And we're starting to see some newer research around that. This study that I brought in is beta-alanine in college-aged runners. So they were given either 250 milligrams of beta-alanine or placebo twice daily for 4 weeks. They participated in a 10K run, both before and after the supplement period, and their blood was tested for inflammatory cytokines at various points at rest, immediately following exercise, and then at 30 and 60 minutes after exercise. And compared with placebo, those who received beta-alanine supplementation actually were able to maintain a more normal inflammatory cytokine level. So the authors stated that this translated to being able to maintain normal immune function post-exercise. Again, it's a small study, a little bit newer, but an interesting look at beta-alanine for supporting the way that the body responds to strenuous or longer distance exercise. And then in this study looked at older adults, so those between the ages of 60 to 80. They were given beta-alanine or placebo daily for 10 weeks and then assessed for cognitive function, some behavioral questionnaires, and physical function at the end of the study. Compared with placebo, supplementation of beta-alanine was associated with better cognitive function, and that was particularly in those who had borderline to below normal performance at baseline. So maybe less so in those who already had good cognitive performance at the beginning of the study. Again, it's kind of a newer study. There's not a lot in this area yet, but it's an interesting look at how beta-alanine might support healthy aging. Branched chain amino acids are 3 of the 9 essential amino acids, so leucine, isoleucine, and valine. Among these, leucine is considered the most important for supporting muscle. It helps to signal that switch from the catabolic stage to the anabolic stage, so helping with muscle repair and recovery. Among supplementation with branched chain amino acids, leucine in a blend of branched chain amino acids or all of the essential amino acids tends to be better than leucine alone. And I wanted to give a little bit of a look at the International Society of Sports Nutrition's position stand on the use of essential amino acids and some of the key takeaways here. So essential amino acids are beneficial for muscle recovery and repair, and that's both with and without exercise. However, they recognize that the two are complementary, which basically the sum of supplementation of the amino acids and exercise is better than either alone. It's also interesting to note that in aging individuals, those who used essential amino acids with a high percentage of leucine tend to benefit the most for that muscle maintenance and repair. And then some other points here, free-form amino acids lead to a quicker rise in the concentration in the body, which makes sense because with an intact protein, you would have to break that down to then extract the amino acids. So free-form amino acids can be a really easy way to increase amino acid content in the body so that the body can use it quickly. And then with aging, more leucine is needed to flip that switch, and that's because of anabolic resistance that develops as we start to lose muscle tissue as we age. And then last, I wanted to talk about whey protein. So whey protein is a complete protein that contains all of the essential amino acids and is naturally about 10% leucine. So it's a high leucine protein, a nice way to get that support for muscle health. A look at sort of the two main sources are whey protein concentrate and whey protein isolate. So whey protein isolate tends to be a bit more concentrated with 90 to 95% whey protein and a slightly higher protein bioavailability score, but when it comes to digestibility, they are about the same. And then the last study I wanted to talk about, I thought this one was super interesting, and this is hot off the press in 2025. This was a study where women who were getting ready to undergo gynecological surgery received either standard of care or standard of care plus 23 grams of whey protein isolate on the evening before surgery and then on the first post-operative day. And then they followed those study participants to see how long they stayed in the hospital and what their return to gastrointestinal function was. And then compared to standard of care alone, the addition of whey protein supplementation led to a shorter hospital stay as well as a faster time to that first bowel movement after surgery. So an interesting way to support patients who are getting ready to go into surgery. It might be nice to offer some whey protein to benefit their recovery from surgery as well. Okay, that's all I have. So I believe we are going to move into our question and answer time now.
Yeah. All right. Thank you so much. I do have some questions for you.
Oh, great.
Yeah, that was excellent. Okay, first one here. Does Thorne have any special protocols or extra prescribing information on your supplements? More about Thorne's polyresveratrol, the SR, type, especially as to inflammation, decreasing cytokine balancing, and do you have any insights for long-haul COVID patients with vagus dysfunction and other problems?
Oh, that's a big question. Okay.
Yeah.
So yes and no. I would say the easiest way to get deeper information is to, if you have an account rep, reach out to your account rep who can work with our medical team to get some information on some of those things. We do have lots of references that are for practitioners only, and those are, of course, not readily available on the website because they need to be available only for practitioners. We do have kind of a follow-up. Here it is. Perfect. So you can reach out to Erin Marino, who is absolutely lovely, and her email address is there. If you don't have an account rep, she will make sure that you are connected with someone who can help you. And this is, we're happy to get you whatever information we have, and so please reach out to us.
Okay, great. That's always great to have that resource for people because I know these webinars go so fast and there's so many questions. So this one, how does beta-alanine compare with HMB for maintaining muscle mass?
Oh, that's a great question. And I have to be honest with you, I have not looked into the two in a direct head-to-head comparison. So I'm not sure that I could speak really well to that. But I will say that, I believe that they are supporting muscle mass and maintenance slightly differently. And so it may be that they are complementary even when used together, which could be something to consider.
Okay. This question, how can everyday consumers who aren't elite athletes, right? Or aren't, because I forget the tennis player's name, but I know that she just got in trouble for like a supplement. So this is such an important, as you said, if your body is your livelihood, it's such an important topic. But for everyday consumers, how can they benefit from choosing NSF certified for sports products?
Yeah, I love this question because it can be really confusing, and we're constantly seeing in the news where there's some supplement that's been tested and something was found in it that shouldn't be there or that's harmful, and it's hard to know that. I mean, everything looks really great when you see it in the store or on their website, but that's where these third-party certifications come in and are really important. What I love about the NSF certifications is even if someone's just doing the base level NSF certification, they're at least getting audited once a year. And so you could get away with something being in your product for a certain period of time, but eventually it's going to catch up to you. Now, if you are using an NSF certified for sport product, every single lot, every single batch is tested individually. So you're never going to go wrong with that. It does unfortunately cost a little bit more because there is a cost that goes into having that certification and maintaining it. But peace of mind, because you always know that every single batch has been tested by a third party.
Yeah, so it just speaks to quality. And I love that at the beginning of your presentation, you kind of tackled that big misconception about supplements and quality and safety and regulation and all of that stuff. But there's more. You've got resources for your questions. We will get them answered. But Dr. Greer, thank you so much for this. And everybody, thanks for attending and engaging in today's session. Again, There will be a recording, and in a couple of days, not only will it be emailed to you, but it will be at fullscript.com/webinars. Again, we're going to take 5-minute breaks. Really want to respect your time. There's one last session. So go grab some water, and we're going to see you soon.